I feel a bit like I'm talking to one of my best girlfriends this morning. Dr. Shayla Toombs Withers is here. She, of course, has the Essence of Health Wellness Clinic, and our topic this morning is women's health in general, but kind of specifically hormones. You want to focus a bit on hormones this morning.
Right, yeah, it's one of those things that we as women know as we age that our hormones will shift and change, but it's also one of those things where a lot of times we don't realize that it's even a hormonal issue that may be causing some of those concerns and those symptoms that we may be getting.
Is it in part because they grow into a problem slowly, and so you kind of just condition yourself to it as you go?
Exactly. Yeah, so the hormonal change is slow. For example, we know that the menopausal process can occur even over like 10 years for a lot of individuals. So, imagine dealing with something for 10 years. It's a really long time to not realize, what it may be contributing to.
Right.
And you may still be having cycles. So you really don't realize that that's the connection, and you can still be cycling but still be having these hormonal changes early on that can cause these symptoms. The other thing about women is a lot of times we're busy, we work, we take care of kids, you have a partner, all of these things, and so a lot of times you're just going through life and you don't even realize what's contributing.
Okay, so little things like I'm in my mid-50s, right? So I catch myself getting tired. If I sit down at 3 o'clock in the afternoon, not a good idea.
Yeah.
The brain fog is a real thing.
Right.
You get used to it, but maybe that's hormonal?
Yeah, it definitely can be. Yeah, that brain fog, that fatigue, even just those mood shifts, for example, where you watch something on the TV and you may feel a little weepy, like, oh, what's going on? Like, why is this happening? So even just those little shifts can be a sign of that. A lot of times with the brain fog, there's certainly other conditions that can cause it, but, sometimes we'll even say, oh, I'm just forgetful, or, oh, the kids were doing this, so I just forgot, kind of thing. But it should be recognized and monitored, because these definitely can be hormonal shifts.
So I want to talk a little bit about Essence of Health.
Yeah.
Because first of all, don't you love the name? The essence of your health comes from so many different inputs that go into it. It's not just what you eat or the medicines you take, it's all of it in total.
Right.
You are concierge medicine.
I am.
So you really get to know your patients.
Exactly. Yeah. So with Essence of Health, the slogan is the essence of health is in you. And the reason I chose that, because within each of us, we know there are certain things about our bodies, and we know that these things can impact our lives and our wellness. And so within the practice, we sit, we focus, we have prolonged visits. Folks can directly contact me, and we sit down and we really go through all of those concerns in depth and what may be contributing to them. So even, beyond just, for example, the brain fog. So we'll go into, well, what's your work schedule look like? Well, how much sleep are you getting? What types of things do you typically eat? So we'll look at all of those different aspects and still test your hormones and for those other possible contributory conditions, so that we get to the root cause really of what's going on.
You are in your pink.
I am.
And it is Breast Cancer Awareness Month.
Right.
Do you find that women are staying on top of screenings and that type of thing in your practice?
So the screenings are so important, and part of it is that the screening recommendations have changed over the years. So I feel like some women are, truly confused, which is valid, because they have changed. And a part of the screening guidelines now is to really have a more in-depth discussion with your doctor to know when you should be screened and at what frequency you should be screened, because a lot of risk factors and things can play a part into that. But screening is so important. We know that screening saves lives. We know that if folks are screened appropriately and early, then their chances of breast cancer complications is much lower. So it's definitely important.
If you had 10 women in a room sitting around a table, and they were all within a 5-year age bracket of each other, would each of those 10 women have their hormones going in different ways?
Yes, very likely. And even if they were the same age, their hormones could still be going in different ways.
So if you're going through the change of life and your friends are experiencing something that you're not, doesn't mean that you're not experiencing something in your own right. It just might not be what they're seeing.
Exactly.
Okay. And I'm probably being way limiting by talking about the change of life. Because we're born with hormones, we die with hormones, so we have to always be kind of monitoring them. Is that right?
Right, exactly. And you know, it's one of those things where we are born with hormones, and as we age, your hormones are going to change. That's just the natural progression. But the timing of it is so variable from each individual. So that's, you know, where it's so important to talk to your doctor and get those levels checked, and to just recognize what may be going on with your body.
Well, how often do you hear doctors say we get to have a prolonged visit? Not very often. You will find her at Essence of Health Wellness Center on Martin Luther King Boulevard. 805-2245 is her phone number. Online, it's essenceofhealthwellnessclinic.com. I love it. The essence of health is you.
Thank you.
West Yellow Knife Trading Post has everything under the sun. First quality LVP click lock with 12 mil wear layer, 9 great colors. Plus unboxed click lock at $1 per square foot. Box grip strip at $1.09 per square foot. Don't pay big box prices. You better get it when you see it at West Yellow Knife.
Hi, I'm Jack Allen. You know, I hadn't seen my congressman lately. I bet you hadn't either.